Hi, everyone, and welcome to the CycleWise webinar. My name is Natalie Lascano, and I am one of the wellness coordinators with Gator Care. So in this presentation, we'll be covering the female hormone cycle that influences menstruation and the processes occurring in our bodies throughout the month. Hopefully, throughout this presentation, you should gain a greater understanding of your body's natural rhythms and be prepared to track your cycle so that you know what is normal for your body. I also hope that you leave here with a feeling of acceptance towards your bodies. Oftentimes, women feel a sense of animosity or dread concerning their periods, and this is in part due to negative stereotypes concerning menstruation depicted in the media or in society in general. I mean, just think about how many times you may have seen in a show or even in real life a woman being asked if she's on her period because she's upset or acting quote unquote hysterical. These stereotypes have unfortunately been pervasive for generations, and they've taught women to feel like their cycle was something gross or something that they should be embarrassed of. In actuality, menstruation is just a normal, natural bodily function for females, the same as breathing or digestion. So I'd like to begin with this quote from Harriet Beecher Stowe, which is that a woman's health is her capital. When we are healthy, we cannot function at our best, and for women, the menstrual cycle is a crucial factor in our overall health. Although many people may be under the assumption that menstruation is only relevant for reproduction or creating children, the hormones involved in menstruation also impact our bone strength, heart health, and mental and emotional well-being. Unfortunately, according to the National Institutes of Health, only half of women in the US know the average number of days for a regular menstrual cycle, and almost 70% do not keep any log of their menstrual cycle, making it more difficult to identify abnormalities or changes. We will be covering all stages of the menstrual cycle in this presentation, as well as the changes that occur in our cycles during different life stages so that you know what to expect as you age, or if you happen to have a daughter or loved one in your life who is an adolescent or young woman, you can help to answer some of their questions as well. So the menstrual cycle relies on an intricate balance of hormones throughout the body. You can think of hormones as levers in the brain and other organs, like the ovaries, that are pulled to increase or decrease levels of chemicals in the bloodstream in order to initiate or terminate specific reactions throughout the body. So here we'll just cover the hormones that are most important to the menstrual cycle and that I'll be mentioning throughout this presentation so you have kind of like a baseline to know what I'm talking about. So first is the gonadotropic releasing hormone, or GnRH. The production of this hormone begins at puberty and serves as the precursor to FSH and LH. And then FSH stands for follicle stimulating hormone, and this hormone regulates menstrual cycle and stimulates the production of estrogen by the ovaries. It also prepares eggs for ovulation through maturation. Then there is luteinizing hormone, or LH, which also regulates the menstrual cycle alongside FSH by serving as the precursor to progesterone and is released only in the second half of the menstrual cycle. And then there is estrogen, which is also sometimes referred to as estradiol. So if you ever see that term, it's just a different form of estrogen. But this helps to develop the female sex traits such as breast, widening of hips, and storing of fat in the body. It is also produced by the placenta to help maintain a healthy pregnancy, thickens the lining of the uterus during the menstrual cycle, and regulates ovulation. Finally, there is progesterone, which also thickens the lining of the uterus after ovulation by increasing blood flow and vascularization. It also regulates bleeding during menstruation. And then testosterone does also play a small part in the female hormone cycle, even though we commonly hear about it in reference to males. But as you can see, these hormones follow from one another, basically like a chain reaction. So first we have GnRH, which begins at puberty, which leads to the production of FSH and luteinizing hormone, or LH, which in turn leads to production of estrogen and progesterone. So it's actually quite incredible to think of all the tiny little chemical reactions your body has to get just right so that natural functions that we're not even thinking about, are not within our control at all, can occur just as they're supposed to and keep us moving and grooving. So now we'll talk about puberty, and this is when the menstrual cycle begins in females. So menarche is a term used to describe a girl's first period and usually occurs between the ages of 10 to 16, with girls who are active in sports typically experiencing menarche later than their peers who are not as physically active. And then our first period is caused by an increase in FSH and LH following that initial production of GnRH. And then fluctuating levels of estrogen in response to production of FSH causes the uterine lining in girls to grow and then regress until finally the hormone levels are high enough that the lining grows to the point that menarche commences when estrogen decreases again. So it's kind of like the uterus is warming up before menarche actually occurs between the ages of 10 and 16. And then progesterone is still low at the time of menarche, but increases sharply afterwards, eventually leading to the first ovulation, typically 6 to 9 months after the first period. So that's why it is very, very rare for a girl to get pregnant before her very first period, because typically ovulation has not started until after our first period, which is kind of interesting to think about because I think a lot of times we think of ovulation and menstruation as kind of one and the same, kind of interchangeable terms, but they're not. They are two separate but very much interlinked processes within our body. All right, so now we will discuss the 4 stages of the menstrual cycle, which include menses, luteal, follicular, and ovulatory. Each menstrual cycle begins on the first day of your period and lasts until the first day of your next period. So on average, the menstrual cycle is 28 days, but anything between 15 and 35 days is normal. And your menstrual cycle length may fluctuate due to weight loss or gain, excessive exercise, stress, or a variety of other factors. So while it is normal to have a shorter and longer menstrual cycle every now and then, if your cycle suddenly becomes very irregular, whereas it's like 15 days one cycle, but then the next cycle is 28 days, and then it drops back down, it becomes very irregular in that way, you may want to speak to your gynecologist or other healthcare provider. And each phase of the menstrual cycle is associated with different hormonal changes in the body, of course, but these changes may also impact our mood, motivation, circadian rhythms, energy levels, and other factors of our daily routines, which we'll discuss in depth with each stage. So first we have menses, which alongside the follicular phase comprises the first few days of the menstrual cycle and consists of the shedding of the uterine lining, resulting in the excretion of blood and tissue from the vagina. It typically lasts between 3 and 5 days, but as long as 7 days is also normal. And we're all probably very familiar with the symptoms of menses. We get abdominal cramping, lower back pain, sore breasts, cravings, gastrointestinal issues, mood swings, and fatigue. These are all very common and very normal symptoms of menses. And many women also experience low iron levels, an essential nutrient, due to the blood loss associated with menses, and this may cause some of that fatigue that you may experience during your period. And iron supplements have been found to reduce period pain, as well as alleviate period fatigue symptoms in menstruating women. So if you are interested in taking iron to help with your period symptoms, please make sure to speak to a provider before taking any supplements. However, increasing protein in your diet, whether that's through meat or plant-based proteins such as quinoa or soy, can also increase iron levels and help with these symptoms. Next, we have the follicular phase, which coincides with menses as it also begins on the first day of your period, but lasts longer than the number of days you are bleeding. Typically, women complete the follicular phase on day 14 of their cycle, so about halfway through. And this phase is called such because the egg cells in your ovaries are referred to as follicles, and during this time period, a certain number of follicles are maturing in the ovaries, but only one will actually fully mature. This mature follicle will then be released during ovulation, which we'll talk about next. And maturation of this follicle is completed between days 10 and 14 of your cycle. And during this phase, your ovaries are rapidly producing estrogen, which in turn leads to increased serotonin, a happy hormone being released in the brain. This would explain why you feel more energized, sociable, and clear-minded during this phase of your cycle. You may also find that you are more interested in exercise or motivated to complete projects and hobbies during these 14 days. So next we'll have ovulation, which is the phase of our cycle second to menses that we might all be the most familiar with. This is when the mature follicle produced by your ovaries is released into the fallopian tube in pursuit of fertilization. This phase only lasts 12 to 24 hours, so it's by far the shortest phase. And this phase of your cycle is triggered by the sharp increase in progesterone just before ovulation, basically opening the door for the follicle to leave the ovary. This means if you are interested in becoming pregnant now or in the future, or if you're just curious, that the best chances of conceiving would be in the 3 days leading up to ovulation, because sperm can survive in the uterus for about 3 to 5 days. Thus, the 3 to 4 days leading up to ovulation are commonly referred to as the fertile window. Cervical mucus is a common symptom of ovulation, and you will typically notice a sharp increase in discharge in the days leading up to it. And then Mittelschmerz, which is a very fun word to say, is the term used to describe ovulation pain, which occurs when the ovarian follicle ruptures and releases a mature egg. Not all women experience Mittelschmerz, but if you have ever felt a sharp pain on one side of your abdomen, I would personally describe it like a needle prick going through a specific spot on the left or right side, then you have most likely experienced ovulation pain. This means you are quite literally feeling when your ovary releases an egg. Women have reported feeling improved mood, increased sex drive, and heightened feelings of attractiveness during this time, which is all believed to increase chances of pregnancy from an evolutionary standpoint. So then this is just a rendering of the process I just described, which is what's happening in the ovary leading up to ovulation. So you can see here that the egg cell, which is the oocyte, is kept within this larger sac called the follicle, that this sac gradually grows along with the egg cell in response to FSH and LH, which are being released and produced during this time. And then finally, just one of the handful of maturing egg cells completes this process, and the follicle ruptures and the egg cell is released from the ovary out into the fallopian tube, where it'll make its way to the uterus. Then the egg cells that did not complete maturation are just reabsorbed into the body. So you are technically losing more than one egg cell every month, though only one would be viable for creating a pregnancy, which is that one that pops out of the follicle. Right. So finally, we have the luteal phase, which comprises the latter half of the menstrual cycle between days 15 and 28. During this phase, the mature egg is traveling to the uterus, where progesterone is working hard to build up the lining of the uterus to make it nice and comfortable for the potential baby that might result from ovulation. However, if pregnancy does not occur, estrogen and progesterone plummet rapidly and eventually lead to menses, beginning this whole cycle all over again. And progesterone may initially improve sleep and lower anxiety, but it can also cause bloating, constipation, and fluid retention. So if you weigh yourself regularly, and if you've ever noticed you weigh a couple pounds more 2 weeks out of the month, it's likely due to the fluid retention associated with this phase. Then decreasing hormone levels during this phase are also the cause of our beloved premenstrual syndrome or PMS symptoms, including low libido, increased feelings of anxiety or depression, brain fog, appetite changes, and sleep changes. These are all very common symptoms, with Mayo Clinic reporting that about 3 in every 4 women have experienced some form of PMS. So tracking your cycle can offer a range of benefits for both your physical and mental well-being. But some of the key advantages include helping you to become more aware of your body's natural rhythms and changes, just allowing you to understand what is normal for you and what may be a cause for concern. It also helps you to predict your next period and your fertile window if that is relevant for you. And then by logging symptoms like cramps, mood swings, or headaches, you can identify patterns and potentially link them to specific phases of your cycle, leading to better symptom management. Then tracking emotional and psychological changes can help you recognize how your cycle affects your mental health and enabling you to take proactive steps to manage mood swings or anxiety. And detailed records of your cycle can provide valuable information to healthcare providers, aiding in the diagnosis and treatment of conditions like PCOS, endometriosis, or irregular periods. I'm sure we've all been asked by our provider when was the date of our last period during an appointment. Being able to look up that exact date on your phone rather than just guessing or giving kind of an estimate can be very useful. And understanding how your energy levels and nutritional needs change throughout your cycle can help you tailor your exercise and diet for maximum effectiveness and comfort. For example, you might want to plan to do a harder workout during your follicular phase when you might feel more motivated to exercise. And overall, tracking your cycle can give you a sense of control and empowerment over your reproductive health, enhancing your ability to make informed decisions about your body. Okay. So effectively tracking your menstrual cycle can be done through various methods and with great attention to detail. But here are 5 key strategies on how to track your cycle. So first, you want to decide on whether you prefer using a digital app, a physical calendar, or a dedicated journal. I personally just use the Health app in iPhone. It has a section for tracking your cycle, and then on Android, the Samsung Health app has something very similar, and it allows you to track your period start and end dates, any symptoms you are experiencing. It'll also eventually start giving you a prediction for your fertile window if you use it long enough, and you can track a variety of other aspects of your health and wellness and see how maybe that is correlating with your cycle in any way. And it can also be very customizable, and there are other apps available on the App Store that are specifically made for tracking your cycle, so you may want to look into those. And many of these apps also offer additional features like reminders and symptom tracking, like I mentioned. Whereas if you just want to keep like a personal journal or a physical journal or a physical calendar, that might be more customizable to your preferences. But you can just decide on whichever system works best for you. And mainly you just want to choose whichever one you are actually going to stick with because consistency is key. And going along with that, you want to consistently log the start and end dates of your period each month. This just helps to establish the length and regularity of your cycle, which of course is crucial for predicting future periods and identifying any irregularities. Also, make sure to note any symptoms you experience throughout your cycle, not just when you're on your period, but throughout the entire month, such as cramps, headaches, bloating, mood swings, changes in energy levels, whatever it may be. And then, of course, if relevant to your needs, you'll want to track signs of ovulation, such as changes in cervical mucus, basal body temperature, which is just your body temperature at rest, or ovulation test results. And of course, this is especially important for those trying to conceive or who are practicing fertility awareness methods. And then regularly review your tracking data to identify patterns and adjust as needed. Periodically updating and analyzing your records can enhance the accuracy and usefulness of your cycle tracking. Okay. So now we'll talk about how pregnancy affects the menstrual cycle. So pregnancy occurs when a fertilized egg implants in the uterus, stopping the regular menstrual cycle for the duration of the pregnancy. And during this time, the body is focused almost completely on growing and supporting this new life, leading to the production of two hormones which are made only during pregnancy, which are human chorionic gonadotropic hormone, which is tested for by pregnancy tests and may also play a part in the nausea and vomiting often associated with the first trimester. And then there's the human placental lactogen, and as the name implies, this hormone is produced by the placenta and helps stimulate the milk glands for breastfeeding. Then estrogen and progesterone also continue to be produced during this time period and are utilized during pregnancy, but apart from that, the regular menstrual cycle ceases for the duration of the pregnancy. Okay. So now we'll also touch on how birth control can affect your cycle. So specifically hormonal birth control, such as the contraception pill. So hormonal birth control prevents your body from creating the hormones associated with ovulation, resulting in either artificial cyclical bleeding, meaning cyclical bleeding without ovulation, or complete suppression of the menstrual cycle. And apart from the prevention of pregnancy, birth control is associated with other benefits for some women, including helping to regulate the menstrual cycle, making periods more predictable, and reducing the frequency of irregular and missed periods. Many women also experience lighter or shorter periods while on birth control as the hormones in the pills thin the uterine lining. And then birth control can also alleviate dysmenorrhea, which is a term used to describe painful periods, by reducing the production of prostaglandins, which are chemicals that cause uterine contractions. And common symptoms associated with birth control include breakthrough bleeding, nausea, breast tenderness, mood changes, and headaches, which usually subside after a few months of use. And according to Mayo Clinic, there are some risks associated with long-term hormonal birth control use, including increased incidence of blood clots and some cancers. So if this is something you are interested in taking for yourself, make sure to speak to your provider about all aspects of birth control use, including the benefits and risks, just to make sure you are making the best decision for your health. Okay. So now we'll touch on menopause, which is the natural biological process marking the end of a woman's menstrual cycles and reproductive years, and it is diagnosed after 12 consecutive months without a period, typically occurring between ages 45 and 55. So menopause is caused by a decline in the hormones estrogen and progesterone, leading to the cessation of ovarian follicle production, which of course is what is necessary for that egg cell maturation that we spoke about earlier. And the transition period leading up to menopause, known as perimenopause, can last several years, but typically begins in a woman's 40s or sometimes late 30s. Menopause itself is a point in time, but symptoms can last for up to a decade after. And common symptoms of menopause include hot flashes, night sweats, mood swings, vaginal dryness, sleep disturbances, and decreased libido. And treatments for menopause symptoms include hormone replacement therapy or HRT, lifestyle changes, mainly involving diet and exercise, and some non-hormonal medications. Again, make sure to speak to your provider about the best option for you when seeking treatment for any of these symptoms. So now we'll talk about hormonal imbalances, which can be caused by factors such as stress, significant weight loss or gain, underlying conditions, thyroid disorders, poor nutrition, and certain medications. Hormonal imbalances often lead to irregular menstrual cycles, causing periods to be missed, more frequent or painful, or varying in duration and flow. And common conditions associated with hormonal imbalances include PCOS and amenorrhea. And PCOS, or polycystic ovarian syndrome, is a common condition resulting from hormonal imbalances that cause irregular periods, ovarian cysts, and elevated levels of androgens, which are a male hormone. And then amenorrhea is the absence of menstruation for 3 or more months in a woman of reproductive age, so a woman before menopause or perimenopause, and can result from hormonal imbalances due to factors like extreme weight changes, stress, and medical or other medical conditions. And symptoms of hormonal imbalances affecting the menstrual cycle include acne, weight gain, hair loss or excessive hair growth, fatigue, mood swings, and even infertility in some cases. So please speak to your provider if you believe you're experiencing any of these symptoms or conditions. So I want to talk about how to maintain your hormone health. So the first thing is to consume a balanced diet rich specifically in protein, fiber, and healthy fats, such as olive oil, nuts and seeds, avocados, and fish. These all help to support hormone production and regulation, help maintain stable blood sugar levels, and can alleviate symptoms related to hormonal imbalances. And then engaging in stress management techniques such as yoga, meditation, yoga, deep breathing exercises, or mindfulness can reduce cortisol levels and help balance other hormones, promoting overall hormonal health and regular menstrual cycles. And regular physical activity reduces stress and supports a healthy weight, all of which are crucial for maintaining balanced hormone levels and a regular menstrual cycle. And this can be something just as simple as walking for 15 to 30 minutes a day. Lower body exercises, specifically those targeting the core, have also been found to be beneficial in reducing period pain. And then consistent high quality sleep is essential for hormonal regulation, as sleep disturbances can lead to imbalances in hormones like cortisol, melatonin, and insulin, which in turn affect the menstrual cycle. As I mentioned before, all of these hormones are working in our body as a chain reaction. So even hormones that are not typically associated with the menstrual cycle can still affect our menstrual cycle just the same, even though their primary function is not in that role. So if you have any trouble sleeping, we do have a fantastic sleep program on our website, gatorcare.org, called Peaceful Z's that can provide tips and insights on how to get your best night's sleep. However, for the most part, you want to make sure you are going to bed and waking up around the same times every day to support a consistent circadian rhythm. And then reducing or eliminating tobacco use and limiting alcohol intake can prevent disruptions in hormone levels, improve reproductive health, such as egg cell quality, and reduce the risk of menstrual irregularities. And then I also want to take a second to touch on endocrine disruptors, which I think has become more of a buzzword on social media and elsewhere in recent years. So endocrine disruptors are chemicals that interfere with the body's hormonal systems, causing health issues and potentially disrupting the hormone cycle by mimicking, blocking, or altering hormonal health. You may have heard of some common ones such as BPA in plastic, phthalates in certain cosmetic products, and pesticides used in agriculture. These chemicals are absorbed through the body and through 3 pathways, including ingestion, so eating it, inhalation, breathing it in, and dermal or skin absorption. And exposure to some endocrine disruptors can result in irregular periods, changes in menstrual flow, more severe menstrual cramps, and increased risk of infertility. With that being said, exposure alone is not enough to cause health concerns. A common phrase in the study of toxicology is the dose makes the poison, meaning that the level of a chemical that you are exposed to usually determines the effect it will have on your health. The human body is specially designed to eliminate toxins before they become harmful to you. That's the purpose of organs such as the kidney and the liver. And it is only after prolonged or high levels of exposure that a chemical may cause harm. For example, aluminums and antiperspirants have been getting a bad rep recently, with claims that using deodorant with aluminum can lead to breast cancer. However, according to the American Cancer Society, there is no evidence for a link between aluminum and breast cancer, as the body is able to handle the level of aluminum in deodorants without harm. The National Kidney Foundation has issued advisories warning those with kidney disease to avoid using aluminum deodorants, but this is because those with kidney disease are not able to eliminate aluminum efficiently through natural processes, allowing it to accumulate in higher amounts in the body. So this is all to say that you should not freak out if you hear that some sort of chemical in a product that you use regularly can cause endocrine issues or hormonal issues. For the most part, just make sure to speak to your provider if you think you may have been exposed to a certain chemical that is causing you harm, or if you have questions regarding your risk related to certain product usage. You can also find additional resources on women's health and a variety of other aspects of health on the gatorcare.org website. We have resources for every single dimension of wellness you can think of. We also offer one-on-one health coaching, which you can schedule by emailing gatorcarewellness@shands.ufl.edu. And then if you are pregnant or expecting, or you are planning to get pregnant, the Healthy Addition program for Florida Blue members does offer personalized counseling and additional care for prenatal women. And if you have any questions, please email gatorcarewellness@shands.ufl.edu. And thank you so much for joining me in this CycleWise webinar.